Good afternoon. Now, due to the election campaign, the last time I stood here to give you a COVID briefing was 3 weeks ago, so I'm glad today to be able to provide a full update and, most importantly, of course, to set out our decisions on the next steps forward. My remarks today will therefore necessarily be slightly longer than usual, so please bear with me, and thank you to everybody who has tuned in today. As you can see, I'm joined by the Chief Medical Officer and the National Clinical Director, and they'll help me answer questions shortly. Before that, though, I am able to confirm that the main purpose of my remarks is to give the go-ahead to the move to level 2 with the associated changes to the COVID rules that had been scheduled for Monday the 17th of May. I can confirm that that will go ahead as planned in most parts of Scotland, and I'll come back to that point in a second. Indeed, in one respect, which I'll also cover shortly, we are able to go slightly further than previously anticipated. However, there are two geographic exceptions to this, which I will flag up now but cover in more detail later on. In recent days, as you will have undoubtedly seen in news coverage, Moray has been experiencing a high and increasing number of cases with a small associated increase in hospital admissions. Indeed, public health experts consider that Moray is currently experiencing widespread community transmission of the virus. It is therefore highly probable, though a final decision will be taken at the end of this week, that Moray will remain in level 3 for a further period, although I hope it will be a relatively short one. However, more happily, the situation in some of our island communities is now sufficiently under control that we're able to ease restrictions there more quickly than we will do on the mainland. Therefore, from Monday, we expect that island communities will move down to level 1. Now, I'm going to come on to more detail on all of that at a slightly later point, but I wanted to flag up the main decisions at the outset of this statement. Now, normally at this point, I would update you on the daily statistics. Unfortunately, I'm not able to do that right now due to a significant IT issue affecting Public Health Scotland this morning. I hope that will be resolved soon, and I can assure you that all of today's figures will be published just as quickly as possible, and you'll be able to access them when they are published on the Scottish Government website. However, what we know from our recent run of daily statistics is that over the past 3 weeks, the success of the vaccination programme, the huge success of the vaccination programme, and of course I want to convey again my thanks to everyone involved in that, but its success, coupled with the continued high compliance on the part of the general population with the various rules and restrictions that have been in place, all of that has combined to ensure a continued suppression of the virus. Since I last stood here to give a briefing, cases have continued to fall from an average of 226 new cases a day to 177 new cases a day on average now. That said, in the last week, we have seen a very slight increase in cases. That is driven largely by the situation in Moray that I've referred to already and will come on to a bit more fully shortly. But the situation in Moray, together with the emergence of new variants globally, should be a sharp reminder to all of us that the virus remains a very real threat, not just here in Scotland, but of course across the world. And notwithstanding the changes I am about to confirm, we must all continue to be careful, responsible and vigilant. And of course, our levels system means that we can and will, if required, as you will see today, apply the brakes to deal with outbreaks as they arise. However, the situation overall is now a very positive one, and so that means we are in a position to relax more restrictions and to restore much more normality to our everyday lives, which I know is something that everybody is desperate to see. So that improved position overall is why I am able to confirm today that from next Monday, the 17th of May, all parts of mainland Scotland, with, as I said, the highly probable exception of Moray, will move from the current level 3 down to level 2. But before I set out what that means, let me address the exceptions to that. Firstly, some further detail and context on that situation in Moray. At the moment, across Scotland as a whole, we're seeing 23 new cases a week for every 100,000 people in the population. So levels are relatively low and much lower than they've been for a long time in Scotland as a whole. But in Moray, rates are more than 4 times higher than that just now and stand at around 94 new cases per 100,000 people. As I said earlier, there is, in the opinion of public health experts, widespread community transmission happening in Moray just now. And so it's against that backdrop that unless the situation was to materially improve over the next few days, it would simply not be safe or sensible to ease restrictions there from Monday. And that's why I have to flag up today that it is highly probable that Moray will stay at level 3 for a further period. It's also important that we take precautions to reduce the risk of the transmission of COVID that is happening within Moray spreading from there to other parts of Scotland as restrictions start to ease more significantly elsewhere. So if Moray does stay in level 3, which, as I said earlier, will be finally decided at the end of the week, we will also reimpose travel restrictions, again for a hopefully short period. And this will mean that travel in and out of Moray will be limited to permitted purposes only. If the decision is to keep Moray at level 3, and right now I do consider that to be very likely, I can confirm that we will provide additional financial assistance to businesses that will be affected by that. And also, given how deeply unwelcome I know this will be for people living in the Moray area, I can also confirm that we will be doing everything possible to ensure that any extension of level 3 is for as short a period as possible. We're already working closely with both Moray Council and Grampian Health Board to reduce case numbers as quickly as possible. For example, a mobile testing unit has been moved to Elgin and people are being strongly encouraged to take up lateral flow tests. And I would appeal to everyone living in the Moray region to follow all of the public health advice so that we can get the situation back under control just as quickly as possible and then allow Moray to get back onto a positive track as soon as it is safe and possible to do so. Now, looking to the other exception before I come on to the general picture across Scotland, for our island communities, the situation is different and very much more positive. Case numbers have consistently been at low levels, very low levels indeed, for some time now. Many islands also now have very good vaccination coverage and lateral flow tests are available for all people travelling to the islands from other parts of Scotland. So for those reasons, we've decided that it is possible and proportionate to now ease restrictions on the islands more quickly. And that will be for communities in the Western Isles, Shetland and Orkney, for all islands in Highland except Skye, given the fixed link to Skye, and for the Inner Hebrides Islands in Argyll, including Islay, Jura and Mull. All of these areas will move directly to level 1 from Monday rather than to level 2. And the full details of what that means are available on the Scottish Government website, but for example, it means fewer restrictions on indoor hospitality. Now, everywhere else in Scotland will move to level 2 from Monday, so I now want to spend just a little bit of time setting out what that change means in practice. It means, firstly, that we will be able to meet outdoors in groups of 8 from up to 8 households, rather than in groups of 6 from 6 households, as is the case now. And even more significantly, we will be able from Monday to meet in each other's homes, and that includes for overnight stays. Now, it was initially intended that at level 2, up to 4 people from no more than 2 households could meet indoors. However, we consider that it is possible now to go slightly further than that. So from Monday, up to 6 people from 3 households will be able to meet indoors in each other's houses. Now, this is still a cautious change, but it is also a hugely important one. It is almost 8 months now since most of us have been able to meet in each other's homes, and it has been even longer than that for those of us living in Glasgow and Lanarkshire. I know how much everyone has been looking forward to being able to do this again. It is one of the simple pleasures of life that I suspect, and I hope actually, that none of us will ever take quite so much for granted again. Now, this is an important change in and of itself, but I am also pleased to say that in one respect, we consider that it is possible at this stage to go further than previously anticipated. So from Monday, if you are meeting friends and family within the permitted limits, of course, either indoors in a private dwelling, a house, or in your garden, our guidance will say that it is no longer necessary to maintain physical distance, which means, and I actually feel a wee bit emotional saying this, that from Monday, as long as you stay within permitted limits, you can hug your loved ones again. I know how desperate we all are for this, so I don't intend to immediately pour cold water on it, don't worry, but there are two further points I really need to make. Firstly, it remains vital to be cautious and to ease these restrictions carefully. So for the next 3 weeks at least, the easing of the guidance on physical distancing will apply to permitted gatherings in our own homes and gardens only. However, over that period, we will also be conducting a wider review of the need for physical distancing in public indoor places, and we'll set out the conclusions of that at the next review point. And secondly, and this is perhaps the more difficult point, please use careful judgment. Close physical contact does still carry risk. I've got to be very clear with you about that. So if you have loved ones who are vulnerable for any reason, please still be careful and limit the overall number of people that you're choosing to have close physical contact with. It is, at this point, just worth making the point that as we progress, I hope, further into the next phases of the pandemic and easing restrictions as we try to get back to normal, prescriptive rules and regulations will increasingly give way to greater personal judgment. Now, that can and will be difficult. We've all been used to following very rigid rules in the past year, but getting away from that back to the exercising of personal judgment is an essential part of that gradual return to normality. So please continue to be careful and cautious as we take these next steps forward. Let me turn now, though, to the other changes that come with the move to level 2. In hospitality settings, pubs, restaurants and cafes, groups of up to 6 people from up to 3 households will be allowed to meet together. From Monday, alcohol can be served indoors up until 10:30 p.m. and I know that the return of licensed indoor hospitality will be welcomed by both businesses and customers across those parts of the country where that is applying. A new app, Check-in Scotland, was launched at the end of April. That will help test and protect, easily contact people who need to self-isolate. So please download and use that app if you can. Hospitality venues are required to take your contact details, so please make sure you cooperate with that. There are several other important changes that will come into effect next Monday, subject, of course, to appropriate mitigations. So firstly, a number of venues will be able to reopen. These include cinemas, theatres, concert halls, comedy clubs, amusement arcades, casinos, snooker halls and bingo halls. Amateur performing arts groups will be able to perform outdoors initially. Colleges and universities will have more flexibility to resume in-person learning. Outdoor adult contact sports can resume. And more than one person will be able to sing during religious services, and that's a change which many faith groups have asked for and I know will welcome, although at this stage it doesn't include congregational singing. Also, the standard limit for the number of people who can attend specific events will increase. From Monday, up to 100 people will be able to attend an indoor event, up to 250 will be able to attend an outdoor event with unrestricted standing, and up to 500 people will be able to attend an outdoor event with seating. Now, let me stress, these are standard limits, but events organisers have the ability to make applications to hold bigger events, and they will be assessed accordingly. We will continue to review the rules on events in consultation with the event sector, and updated guidance may well be published during the next 3 weeks. And as I said earlier, we'll be reviewing the guidance on physical distancing, and that's relevant to the event sector, but also to many other businesses. And if it is possible over the next few weeks to relax the current rules and guidance on physical distancing, we will certainly do so. Now, finally, I want to confirm that we will make some changes to the rules on international travel. Now, at the outset of this, let me be very, very clear, difficult though I know this is, that we still intend to be highly cautious on international travel, given the risk of new variants. But we consider that the situation now allows us to begin a careful move away from blanket restrictions on non-essential travel overseas. So from Monday, we will move to a traffic light system. This will be informed by risk assessments prepared by the Joint Biosecurity Centre, And these assessments will be based on the state of the pandemic in each country across the world, and that will include the presence of variants of concern. So if you enter Scotland from a red list country, one of the countries identified as acute risk under our current regulations, you will still be required to enter a managed isolation hotel and stay there for 10 days. Due to changes coming into force from tomorrow, these red list countries will include Turkey, the Maldives and Nepal. If you arrive from a country on the amber list, for now that will be the majority of countries, you must self-isolate at home for 10 days and take 2 PCR tests during that period. And we will also introduce a green list of countries. If you travel from a green list country, you will need to take a PCR test shortly after your arrival, but you won't be required to self-isolate. The 4 UK Chief Medical Officers, and Gregor will no doubt say more about this later, have indicated that green list status should be the exception, not the rule. And I very much agree with that approach. There will have to be good reasons for adding a country to the green list and so removing quarantine requirements, and we will not do that lightly. But I can confirm that initially the 12 countries and territories on the green list will be the same as those announced for England. For now, this is a very limited list and it includes Australia, Brunei, the Falkland Islands, the Faroe Islands, Gibraltar, Iceland, Israel, New Zealand, Portugal, St Helena, Accession and Tristan da Cunha, Singapore and finally South Georgia and the South Sandwich Islands. Now, this decision means that as of now, we have a consistent 4 nations position on international travel. I think that is positive, and it has been made possible because the decisions the UK government has arrived at are appropriately cautious. I hope this continues to be the case, but I need to stress that the Scottish Government will continue to take the decisions we consider to be right for Scotland. We will not sign up to decisions that might put our progress at risk. We've made so much progress in suppressing the virus within Scotland. We must not put that at risk now by enabling new variants to enter the country too easily. And for that reason, I want to stress one final point very strongly. Even though the rules on non-essential travel are starting to change, that doesn't mean we're saying that non-essential international travel is desirable. Everyone should think seriously about whether they need to travel abroad this summer. Now, I know that for many people, international travel is about family connections, and it's understandable that people may want to travel for that. But when it comes to holidays abroad, my advice continues to be to err on the side of caution and to staycation this summer. Now, the importance of following guidance and exercising caution is the note that I want to end on. Next week's changes are really important, the most important yet. I suspect many of you already will be looking forward to meeting up with a friend in your own home, to having a drink indoors in a pub or a restaurant, and perhaps most of all, hugging a member of your close family. Enjoy those moments when they come in just under a week's time. They have been greatly missed and they have been hard-earned by all of us. And I hope and expect that they'll be followed fairly soon by further steps in the right direction. I hope Murray will be in level 2, if not on Monday, then soon. And for the rest of the mainland, I've already said that if circumstances allow, we'll move to level 1 on Monday 7th June and then level 0 on Monday 28th June. Level 0, of course, still involves restrictions, so I hope and expect that we can move on to something much more like normality over the course of the summer and into the autumn. For example, if we can, we'll continue to relax physical distancing rules, and when it's safe to do so, for example, once all of the adult is fully vaccinated, we hope to be able to start to move to the removal of these kinds of rules altogether, but we can't put a date on that quite yet. But in order to ensure that we do continue to make the progress that makes all of this possible, we must continue to exercise good sense and caution. The more we suppress the virus, the more quickly we're going to be able to open things up. So please continue to work from home for now if you can. Use the Check In Scotland app, as I said. Download Protect Scotland if you haven't done so already. Continue to be highly cautious about international travel. And when you're outside, still remember facts. Wear your face covering, avoid places that are busy, clean your hands and surfaces. Still use 2 metre distancing for people outside your own limited groups of family and friends when you're in your own home or in your garden, and self-isolate and get tested if you have symptoms. It's still important that we stick to all of these rules, as so many of us have done now for more than a year. because that is how we continue to look after each other, continue to help the NHS, treat those who need it, and ultimately to save lives. So I hope today's update has been, as I warned you, longer than normal. Gregor and Jason will be getting sore legs as we stand here. But I hope you think it's a positive one. It's been hard-earned, but we must keep doing all the right things so that we continue to move in this positive forward direction. So thank you for bearing with me. Thank you for listening. And I'll now move on at long last to questions, starting with Gordon Cree from STV.
Thank you. Just on that subject of physical distancing, which I'm sure what you've said there is going to be welcomed by many people. There will be those, of course, without gardens who wonder what's the difference between hugging a friend in your garden and doing it in a park. And is there an element of acceptance that people will probably go a bit further than what you've said, priced in to allowing that? And if I can just ask Professor Leitch, on the subject of Murray, even without travel restrictions so far, have you been reassured to some degree that there doesn't seem to have been a degree of leakage of the figures into the surrounding areas? And what's your thoughts on fans at the Scottish Cup final?
OK, I'll very briefly address this question, and then Gregor and Jason may want to comment more widely. On the issue of what makes a garden different to a park, increasingly as we start to come out of restrictions, and we saw this last summer, these apparent anomalies appear. And I know they can be difficult and confusing for people, but I suppose I can summarise it by saying it's simply a case of not wanting to do everything all at once, because we know from past experience if we do that, then quickly it can just run away with us again. So we're trying to, it's been a long time since we've been allowed in each other's homes. It's been a even longer time that we've been able to hug loved ones. So as we start to come out of this, we just want to do it step by step, bit by bit, carefully, putting our toe in the water, making sure that we can cope with that before we go too far. So I suspect all things going as well as we hope, 3 weeks from now, I'll be standing here saying that relaxation of physical distancing can apply in other places. But for now, just be careful and cautious, both in the settings that we're allowing it in, but also in how you choose to behave as an individual. And I know the apparent inconsistencies confuse and frustrate people, but they are simply down to, if we did everything at once, we would very quickly go back the way. And it's simply about trying to avoid that. So I don't know, Gregor, whether you want to add anything on that before I hand over to Jason on the point directed to him on Murray.
Yeah, and I can say a little bit about Murray as well once Jason's finished. But in terms of that, every contact that we have with other people just now puts upward pressure on R, makes the likelihood of transmission just that little bit more great. So that's why there's this very cautious approach that just means we need to kind of ease and reassess and constantly be looking to see what impact this has had both on R and the case rate that we're seeing across the country as well. And that's why some of these small anomalies begin to develop over time as we do that. It's really important that we don't do too much too soon and allow a swamping of infection to come back in just now. I don't think that will happen with the easing that we're going to see in this phase at all. But it's inevitable that each one of these changes begins to exert just that little bit more pressure up the way in R, just as vaccination and all the other measures we continue to take helps to suppress that and keep that as low as possible.
Why don't you keep going on Murray, and then I'll join in after.
So in terms of Murray, just now, so as the First Minister said, we've got a case rate there just of about 94 cases per 100,000. That represents 21 significant infectious networks of people that the Test and Protect teams have identified across the Murray Local Authority region. There's two hot spots in particular up there just now. One round about Elgin, one round about Keith, but not really, it's not confined to those two areas alone. What we're not seeing with these networks, first of all, is any spread of infection into any of the neighbouring local authorities. And when we look at the case rates for places such as Highland and for Aberdeenshire just now, we see that they're very stable, and both of those are under 10 cases per 100,000 just now. It's right that we continue to be vigilant in those areas just now. But at this moment in time, we're not seeing that spread of those infectious networks into those other communities beyond Murray just now. Of course, we want to try to prevent that. That's why the restrictions that we are currently considering for there just now are being considered in that way.
So we are relatively encouraged by the fact Murray hasn't leaked out, and it appears to have slowed, but that's very, very early days, which is why the First Minister isn't saying for sure Murray will not move. That's why we want another few days for that. But we're most worried about Murray compared to the rest of the country. You're hugging outside in pubs and gardens. Risk is about the number of people who do that. We're trying to make these judgments for the population, not just for the individual. The individual hug may be the same risk. If you allow 5.5 million people to do it, of course that risk goes up, and therefore it's gradual. And we think it's proportionate to allow that in private settings first, before we do it in public settings. But a physical distancing review to be done for manufacturing, for industry, for public spaces. The Cup final is relatively straightforward. The Cup final cannot be at Hampden for operational reasons that the SFA and UEFA are doing. If the SFA decide to move the Cup final, that's a matter for them, not for us. We have said these are the numbers you can have in stadia at each of the levels. So we're now moving to level 2 on Monday and level 1, hopefully, on the 7th of June, which would incorporate the Cup final period. That number is a minimum. If the SFA want to apply for more, they apply to the local authority of wherever they choose to hold the game. If it's still too high, it comes to the Scottish Government, and we would decide, with the mitigations and everything else in place, whether that crowd was allowed. But if they move it to a stadia in level 2 outside Hampden, yes, they can have a crowd.
Okay, Glenn Campbell from BBC.
Thanks, First Minister. I wonder how soon you might look to remove social distancing rules in hospitality, workplaces and other settings, what timescale you might be looking at there. And also with the wearing of face masks, what your plans are to discontinue those rules in schools, offices and in transport. And if you're able to, a word on Boris Johnson's plans for a four-nation summit. When and what would that deal with?
On that final question, I spoke to the Prime Minister on Sunday. I indicated a willingness to take part in a four-nation summit. We want to, as we have done all along, work constructively as far as we can together. I asked him for more detail of exactly what he envisaged that summit to cover and be looking at. To the best of my knowledge, unless it's winging its way to me right now, we've not had that yet, but we'll take ideas of our own to that. So no doubt there'll be more information on that made available shortly. On the timescale for physical distancing changes, I said in my opening remarks, we've announced the easing of guidance for in your own home or garden today. Over the next 3 weeks, we will carry out a more fundamental review of physical distancing. I will set out the outcome of that at the next review point, which is 3 weeks' time. I'm not going to preempt what that will say, but we will be looking at other indoor public places, which includes pubs and restaurants, cinemas, etc., to see whether we can have further relaxations of physical distancing. But I think it would be wrong to preempt the review that we're about to carry out. On face coverings, I'm not at this stage indicating any specific change to the guidance on wearing face coverings, but in relation to schools, we will be asking the education subgroup that advises us on these issues within schools to look at this also over the next couple of weeks. So it may be that we are able to say something on face coverings in schools, but again, I don't want to preempt that work that we have asked our expert advisors to do. Obviously, Murray, I think, is a reminder of how we need to be really careful about this, because some of what we are experiencing now in Murray has had an impact on and has involved schools, and therefore that's an important reminder that mitigations in schools continue to be important. But equally, I know from the young people in my own life as well as more generally that young people don't like wearing face masks while they're in school all of the time. So if it is safe to move away from that, we are keen to do it, but we've got to take, I think, the right advice on that and make sure we are reaching a decision that takes all of that into account. James Matthews from Sky.
Thanks very much, First Minister. Can I ask just on the cup final point, have the SFA been in touch about arrangements and about a change of venue? And also on travel, what would you say to those in the travel and aviation industry who say that more creative solutions could have been found before now, that while they respect the health imperative, they could have been helped out when they needed help most? And in a situation where airlines are not coming back to some Scottish airports before the end of the summer, what you've announced today is too little too late.
I don't think we've got anything else to add on the Cup final. As far as I'm aware, the SFA have not made any proposal. I think Jason has covered that fully. On aviation, look, I understand how difficult this is, but there are inescapable facts around this virus, particularly with new variants, and we do not help anybody if we ease up too quickly and therefore allow new variants to seed into the country and send all of us, including aviation and tourism, back the way. So we're taking careful, cautious decisions. The one thing, it's not the only thing, but one thing that the sector has asked us, if at all possible, is to have a four nations approach. And as of now, we have a consistent four nations approach. I hope that can continue. So we'll continue to take the decisions we think are proportionate and keep us as safe as possible from the importation of new variants, which is in nobody's interest. And of course, we'll continue to liaise with the sector about wider support. Matty Sutton from ITV Border.
Thank you, First Minister. Are you able to say that no work to prepare for a second independence referendum will be carried out by the Scottish Government or civil servants and special advisers until after the COVID crisis is over? And who will define when it's over?
I think I made my position clear on that during the election campaign. As I think I'm evidencing right now, my priority is on getting us through this crisis, and that will remain my priority until we're through this crisis. Brian Rutherford from Bauer Radio.
Thank you, First Minister. Three quick questions. Firstly, on Murray, surely as you've called it, a high and increasing number of cases with widespread community transmission, that requires level 4 conditions to nip things in the bud. So why not a short shock to get things under control? And also, what was the source of this outbreak in the first place? Lastly, theatres and concert halls say that physical distancing requirements slash their capacity by up to 3/4, and so it's just not worth reopening. So what will you do to help them?
I know this is not a comment about you, but just I'm noting that the first couple of questions, the first question there was, why are you not being tougher? And the last question was, why are you being so tough? So again, it just illustrates the balances that we have to strike. Gregor or Jason may want to add on Murray. The advice they have given me, and obviously I spent time with both of them yesterday looking at this, is that level 4 is not required. There are some early signs, as Jason said earlier on, that the situation may be beginning to improve in Murray, but we need more time to be sure about that. If it doesn't improve materially over the rest of this week, while we don't think level 4 is required at the moment, we don't think it would be safe to go to level 2. So these are the judgments we will take. Gregor and Jason may want to say something about current understanding about source of the outbreak. And look, physical distancing is not something any of us want to see for longer than necessary, because it is a statement of the obvious that if you have to have customers at 1 metre or 2 metre physical distancing, then the capacity of any business is going to be reduced accordingly. So we don't want that to be the case as for any longer than necessary. But the converse of that is true. If we don't have any physical distancing and there are outbreaks, and those outbreaks seed wider community transmission, then very, very soon it won't be a situation where a pub or a restaurant or a theatre has reduced capacity. They'll very quickly be in the position of having to be closed again altogether. So, you know, I'm afraid, as was the case before my few weeks' absence on the campaign trail, there are no magic solutions to this. We have to manage our way through it carefully and cautiously, and we're making really good progress on that. But the worst thing we could do right now, given that we think we're in a much stronger position, is just to throw all caution to the wind and allow it to run ahead of us again. That would set all of us backwards. Do one of you want to say any more about Murray?
So I can say a little bit about the current data for Murray and why level 3 would appear to be the most appropriate level for it at this moment in time. So decisions still to be finally made on that, depending on what happens over the next few days. But if you look at the data just now, the current case rate of 94 cases per 100,000 and the positivity rate, which is just over 3%, what that suggests is that that level 3 is likely to be adequate to control those measures. However, the local IMT and the national IMT are both keeping this under review just now. They've recommended at this moment in time a number of local actions that are taken to try to improve the situation there. As Jason's already said, we're seeing the first signs of that kind of encouraging improvement with a slight dip in the case rate over the weekend. But we'll continue to monitor that. Level 4 is a much higher degree of restrictions that are put in place, and really we really need to make sure that if we're going to place those type of restrictions on a local community, that there is sufficient justification to do that any of our responses are proportionate. And at this moment in time, from the discussions that we've had through the IMT and myself with the local Director of Public Health, we don't think it's proportionate to move Murray to level 4 at this current time. The virus that we're dealing with in Murray just now, what we've been tracking is the relative proportion of the B117 variant, sometimes known as the Kent variant. That's the variant which is most commonly seen across Scotland. The relative proportion of that virus is consistent with findings that we're seeing across the rest of Scotland. Genomic sampling is also hasn't revealed any signs of any variants of concern other than that 117 that we've become familiar with within that area just now. So we'll continue to monitor this over the next few days, make a final decision at the end of this week as to what happens to Murray, but at this moment in time, there's nothing in the data that suggests we would need to strengthen the move to level 4.
First Minister, can I just ask, First Minister, why are theatres and concert halls better off in England instead of Scotland when it comes to restrictions?
I'm the First Minister of Scotland, and I have to take decisions that I think are right for Scotland, and that's what I have tried to do, and that's what I will continue to try to do. That's my job, that's my duty. I am not in sort of possession of all of the facts and figures to the same extent that I am in Scotland about the situation in England, and England has its own government to take those decisions. I'm the First Minister of Scotland, and I will continue to take decisions that I think are as safe as possible and will get us through this as safely as possible. Phil McDonald from Global Radio.
First Minister, is there any concern about people rushing out to island communities, given restrictions won't be as strict there, and people are being encouraged to holiday at home as well? And is there any update on cases of the Indian variant in Scotland? Apologies if you already addressed that.
Thanks, Phil. Gregor or Jason will say a bit more about the Indian variant. We've had, so the point about island communities is a good one. But we have had the ability to travel to and from islands now for the last few weeks, and we've not seen that have an impact in terms of the virus on islands. Obviously, we monitor that carefully. Obviously, with islands, it's travel and tourism there is already permitted. People don't tend to pop to the islands just because there's a pub with slightly longer opening hours than in the mainland for obvious reasons. I don't mean to be facetious there. But we want people to staycation as long as they're staying safe. We're asking anybody travelling to the islands to do lateral flow testing before they go, so that if they have the virus, they can change their arrangements. So with all of the proper mitigations, both in terms of travel and how people behave on the islands, we're as satisfied as we can be that what we're doing here is safe and cautious. But all of this, of course, we will continue to have to keep under review as we move through the next stages of this. Which one of you wants to take on that?
I go first? Mm-hmm. So the first thing to say about the Indian variant, and forgive me for doing so, is the most important thing about anything to do with India and coronavirus is India. And the response and the destruction you can see playing out in families in that country. And we're doing what we can to engage with them, to help them with both equipment and advice as much as we possibly can. Now, Indian variants, a little bit complex, and Gregor might want to add some science in here. Now, 3 Indian variants, one of which has been upgraded to a variant of concern because it appears to be as transmissible, at least, as the Kent variant. Particularly challenging in England, not huge numbers yet, but certainly accelerating numbers. We have some. Last time I looked, I'm going to say 18. Is that right? Good. So we've got 18 cases of that second version of the Indian variant, and it does appear to be transmitting as well as the Kent variant. What we don't know yet is what it does for disease severity and or vaccine, and that requires more research, and that's why we're keeping a very close eye on it. It's one of the principal things we discussed with the First Minister yesterday, to allow her to make the decisions she's made about travel, because it is a little picture of what the dangers are that could lie ahead for us.
So as Jason said, this variant, which was first identified in India, now has 3 subtypes of it: 01, 02 and 03, if we refer them to that. Of the 01 subtype, we've got 21 cases across Scotland just now. Of the 02, which is the one which Jason has just said was elevated to a variant of concern both by PHE in the UK, but also the WHO yesterday as well. At the moment, we've got 18 cases identified of that, with another 10 provisional cases identified over the course of the weekend that I expect will be confirmed over the course of this week. I expect that more will follow from that as well. All of these cases just now, it's important to emphasise, are either associated with travel or indirectly associated with someone who has travelled. There is no evidence at all of community transmission with this particular variant in Scotland at this moment in time. It's something that we need to continually keep an eye on. We keep under very close scrutiny, and we'll update you as we get more cases, which I expect is almost inevitable, particularly from travel-related purposes.
Neil Pooran from PA.
Thanks, First Minister. In terms of the situation in Murray, are you able to say a bit more about the demographics of where these infections are appearing? Is it mainly among younger people? I note that part of the response has been offering vaccination to the 18 to 39 age group ahead of what would usually be the case. Can you maybe say a bit more about what the uptake of that vaccination has been, and is that a strategy that you might use going forward if we get similar outbreaks elsewhere in Scotland?
Okay, I'll hand over to Gregor.
So as we've been tracking the outbreak in Murray over the last 4 weeks, what we see is that it's associated with a number of different settings. So there's been some which have been associated with educational establishments, many that have been associated with workplace, and particularly the retail sector, with a number of different large shops which have been involved there as well. So we're seeing a demographic which is largely a younger demographic. But it's not solely confined to that younger demographic. If you look at the infectious cases that we're seeing across the country just now, we see the majority of those cases, particularly in the age 25 to 44-year-old group. In Murray just now, what we're seeing is a slightly greater proportion of those, but only slightly greater proportion associated with the younger people, so those in the under 18 age groups just now. But I would emphasise that in terms of the demographic, it's right across the age groups. And we've had, unfortunately, some hospital admissions from older age groups as a consequence of this outbreak as well. We'll continue to track all of it, as I've already said. And in terms of the vaccination that has been put in place to move to those younger age groups, what we will see is, too early to say what the uptake is at, because that's just in the process of starting just now. But by doing this, what we're creating is a safety net in the area to make sure that, as well as the extra measures to restrict transmission within the area, there'll be a safer, broader element of the population who've been vaccinated and are both more likely to be protected from severe disease, but also, we hope, more likely to are less likely to be able to transmit the virus as well.
Gina Davison from the Scotsman.
Hi, thanks, First Minister. Just going back to questions about theatre and entertainment venues, it was mentioned obviously that the situation down south is going to be slightly different. The Nighttime Industries Association up here are looking for some kind of crisis summit with the government to at least start talking about an end date. Is that something that you think that you might be able to organise with them, just so they know how to plan and also promote any events for later in the year?
Yes, we will be happy to talk, as we have done on an ongoing basis, to any group in any sector, specifically on culture and in terms of cultural venues. We'll shortly be announcing an additional £40 million of funding, which is going to allow Creative Scotland to run a second round of the Cultural Organisations and Venues Recovery Fund and also the Performing Arts Venues Relief Fund. And the purpose of that will be to help eligible organisations that didn't receive funding in the first round. So there is some further financial support that is coming very shortly. But also, as I said earlier on, in general terms, but it has specific relevance here. We will be, over the next 3 weeks, assessing physical distancing more generally, so whether or not the current guidance on physical distancing for places like theatres can be relaxed at all, and we will, as I said earlier on, set out the conclusions of that at the next review point. So I would hope, I can't be certain, but I would hope that over that kind of timescale, we will see an easing of the current position, which should help venues like theatres more than is the situation initially. Rachel Watson from the Daily Mail.
Thank you, First Minister. I just wanted to go back. You mentioned lateral flow tests there in relation to island communities. They're obviously made widely available across Scotland a few weeks ago, and I wondered if you had any figures or could talk about the uptake of those and whether that does match your expectations for those. And also just on the traffic light system, you've decided to take a similar or the same approach to the UK government at the moment. There were slight variations last year on the approaches that you did take around international travel. And I just wondered if it was your intention to remain at a UK or a four-nation basis with this moving forward, or whether there could be slight differences as we move forward.
On the first question, I don't have statistics on the uptake of lateral flow testing in front of me just now, but I'm sure we have those, so I'll check that and make them available if we do have them. On the second part of the question, I covered this in my initial remarks, but I'll set it out again. So the traffic light system effectively is the structure that we've put in place, which is common across the UK. The decisions that at this initial stage are the same across the UK are the ones that I can't rule out might be different in future, as they were different in the past. So that is the allocation of different countries to the red, amber or green. If, and it is an if, another government in the UK was to take a decision to put a country into the green category that we thought was simply not a sensible or safe decision, we would reserve the right not to do that and to keep it in amber. I can't tell you whether that situation is going to arise. I hope it won't, because we'll all be making these assessments on the basis of the advice that comes and the assessments that come from the Joint Biosecurity Centre. So I hope that does allow a common Four Nations approach to continue in terms of the detail, but I have to reserve the right. I hope everybody would understand this. I have to reserve the right not to be forced, or not for Scotland not to be forced into decisions that, in my judgment, based on my clinical advice, would not be right for us. And we'll obviously make those judgments as we go along. Christine Lavelle from The Sun.
Thank you, First Minister. It was just on vaccines. The data appears to show supplies are holding up, but the daily vaccinations rate has slowed in the past couple of weeks. And we're also a little bit behind other UK nations in terms of the proportion of the adult population vaccinated. I just wondered if you could give an update just to explain what's happening there.
I don't think that, I mean, the relative positions will fluctuate on a daily basis, but I don't think it is the case to say we are in any way substantially behind the rest of the UK. I mean, I don't have today's figures, obviously, because of the IT problem I referred to earlier on, but certainly in the last few days it is broadly comparable. I think we have been slightly behind Wales, but ahead of England. Now, there may be days where that looks different, but overall, the vaccination programme is going exactly as we would have expected. In terms of supply, you know, it has never been and never will be that we're not using all the supply we have. We have to balance the supplies to take account of certain things that we need to work through. So over the past few weeks, and we flagged this up some time ago, there has been more of a focus and more of our supply being used to do second doses than first doses, and the figures reflect that. We've also had a change to the advice on the use of AstraZeneca, for example, which means as we model our way forward, we have to look not just at global supplies, but at the relative supplies of the different manufacturers, so that we are using that for the appropriate age groups. But there is absolutely, in terms of what's happening is that this vaccination programme is going incredibly well, and that's down to the really hard work of vaccination teams across the country.
So I have them.
Jason has the figures.
So I have them. Scotland has vaccinated 64% of its adult population with 1 dose. England has vaccinated 65%. So it's a bit of a stretch to suggest we're behind. For second doses, Scotland has vaccinated 32.3% and England has vaccinated 32.7%.
I'm sure the Daily Mail can make something of that, but broadly speaking, we're on track. Andy Phillip from the Press and Journal.
Hello. I just wanted to go back to the Murray infections. What does it say about the travel and quarantine rules that we've had? Are there any established links that have got around any of those rules? And is there anything that you would do differently in terms of a travel ban or travel restrictions if they do have to come back in, particularly if it's going to isolate one council area with lots of neighbouring other authorities?
Jason or Gregor can say something about it. I don't think it necessarily says anything about the restrictions or travel bans. We are going to see outbreaks of this virus. That is inevitable. And therefore, when we have obviously we will do everything we can to minimise that and reduce the likelihood of that. But this is an infectious virus which hasn't gone away. So the likelihood is we will see outbreaks, and we need to react to those outbreaks. And the level system gives us the flexibility to do that. Travel restrictions and keeping Murray in a different level to the rest of the country, if indeed that is what happens, we would want that to be for as short a period of time as possible. But this is the kind of thing over the months ahead that we may, just as happened when we came out of lockdown before. I think the first situation like this we had was in Dumfries and Galloway. We then had other instances of more localised outbreaks. We're going to have to recognise that this is a feature that we will have to deal with. And I think we have the systems in place to deal with these effectively. And I hope Murray is evidence of that. Dana, you want to say anything?
There's been 1 or 2 cases that have been identified that have been associated with travel, but the fact that they've been identified and managed so quickly suggests to me that the system is working. And I need to emphasise that is not responsible for the emergence of the increase in cases that we're seeing in Murray just now. Simply, the virus has still not gone away from many of our communities across Scotland just now, and as more and more people come together, there is always the very real risk that we'll start to see some of these localised outbreaks, as we've seen in Murray, taking place. That's why the management, the continued presence of testing and the contact identification is a really important tool in our box to try to make sure that this doesn't kind of present a kind of wider problem for Scotland.
Georgina Hayes from the Telegraph.
Thank you, First Minister. It's looking like school exams this year have been thrown into chaos again, with students who have missed a lot of school and been under significant mental health pressure now having to sit what looks a lot like exam questions. And also now thousands of students are sharing exam questions on social media. And obviously they were told they wouldn't be sitting exams. So who is accountable for this? Is it John Swinney or the SQA? And does the Scottish Government owe students an apology? And also, will the Spanish and Greek islands be treated differently to the mainland in terms of international travel restrictions if their COVID rates are low? Thank you.
In response to that question, we will take whatever decisions we think are necessary to avoid importation of the virus. On the exams, I mean, the SQA oversees the certification process. As I am finding out anew after the election, I and the government are accountable for all of these things in Scotland and always will be. That's the nature of the democratic process, and it's right and proper. We take all of this really seriously. Young people have suffered more, not just in terms of education, but the impact on their lives over the past year than possibly any other group in our society. So these are things that we need to continue to take really seriously, listen to young people and make sure we're working as hard as possible to get the right arrangements in place. The revised certification model for National 5 hire and advanced hires, necessitated by the absence of exams this year, was published, I think, in February. The submission date for provisional grades has been extended to the 25th of June. That provides more time for the gathering of evidence of pupil attainment. It's important to remember the model was developed by the National Qualifications 2021 group, which includes teacher EIS representation. The group has been clear there's no requirement to replicate a full formal exam or prelim diet. The awarding of qualifications will be based on teacher judgment, not on past results, not on algorithms. And the evidence for each individual learner doesn't have to be the same as long as it meets the conditions of assessment relative to the course. So, this is an anxious time for young people, I recognise that, and great care has been and will continue to be taken to make sure that they are supported as fully as possible. On the issue of social media, the SQA, I know, has issued an urgent communication reminding centres about the need to take steps to ensure the security of any assessment material. There was an incident over the weekend, I understand, of assessment material being shared on social media. But learners should only have access to the content of secure assessment materials when they are completing assessments under supervision, and the SQA have taken steps to remind centres of that over the course of the last couple of days. Helen McCardle from the Herald.
Hi, afternoon, First Minister. Just a couple of things for clarification. I just wanted to check in relation to the islands moving into level 1. I wondered, will that include the Isle of Arran? Because I think last year it tended to come under Ayrshire for restrictions. And also, just in relation to the Indian variant in Moray, are you able to say, of the 18 confirmed and 10 provisional cases that we have in Scotland, how many of them have occurred in the Moray area?
Okay, on the first question, I'm going to just, because I think I know the answers, but just to make sure we get it right, we'll publish the list of all of the islands that will go into level 1 on Monday, just as soon as we get back out of here, just so that I'm not giving any information that might not be 100% accurate, because we have in the past, as you say, taken slightly different decisions. With some islands, we've taken different decisions around Skye because of the fixed link there. So we'll publish that full list of islands so that everybody living in one of our islands communities knows exactly what the position is. And on the Murray point, Gregor?
Yeah, I last spoke to the Director of Public Health from Grampian only just this morning, and as of that time, there were still no cases of the B1617 variant which were identified in relation to the Murray outbreak.
Vivian Aitken from the Record.
Good afternoon, First Minister. Just a couple of points. First of all, when we're talking about indoor events with 100 people, does that include weddings and wakes? And otherwise, Boris Johnson had announced 30 people can meet up outdoors. When can Scots realistically expect that level of interaction, considering that 100 people can meet up indoors at special events? Would it not make sense for more people to be allowed to meet up outdoors? And just as a minor third point, can you tell us when or who, or both preferably, the new health minister is going to be? Health Secretary, rather, is going to be?
No, I can't tell you that right now. I will announce that when I have been appointed as First Minister. I'm still legally First Minister, but when I'm reappointed as First Minister and appoint the government, I will tell not just you, but the whole of Scotland, and most importantly Parliament, that in due course. On the other points, we will move to bigger gatherings, outdoors and indoors, when we judge it is safe to do so. I have to take decisions that are right for Scotland. Of course, that's what all leaders in all 4 nations of the UK do. My judgment right now is to go to groups of 30 outdoors would be a step too far too quickly, but I hope in the not too distant future that's where we'll be going to. But I come back to a point I've made earlier on. We will maintain this progress if we do it carefully, cautiously, step by step, and not starting to run before we've established that we're able to walk safely. So I know it's frustrating for people, but I still think longer term it's the best approach to take. On weddings, weddings and funerals, life events are dealt with separately in the route map to other events. And in terms of level 2, the numbers at weddings and funerals, which is the services as well as the receptions or wakes afterwards is 50. At level 1, that goes up to 100, and then at level 0, it goes up to 200. But for most of Scotland from Monday, that will be a limit of 50 at weddings and funerals. Libby Brooks from The Guardian.
Thanks, First Minister. You've spoken in quite a lot of detail in the past about the experience in Scotland last summer with travel, the fact that you were pursuing the elimination strategy, which I know we've been doing this year as well, but that your sense was that the virus was receded because of overseas travel and travel elsewhere in the UK. And earlier this year, you were explaining that that was the reason why travel restrictions were going to remain in place for quite a while to come. Can you explain just the thinking in terms of how that has changed, and also what impact that might have on the strategy going forward? Thanks.
It hasn't really changed. We're just putting more flesh on the bones of what it means in practice. So there are going to be restrictions on travel for some time to come. We will categorise what those restrictions are according to the red, amber, green traffic light system. So the red countries most severe, but at the moment the majority of countries are in amber, and that still requires isolation at home as well as testing. And even in the green list countries, which at the moment are a very small list of countries, that still requires PCR testing. And these are mitigations that we didn't have in place last summer as we started to open up international travel to anything like the same extent. So we are being much more cautious now, both in terms of the mitigations and in terms of the speed at which we are opening up international travel. And I think that is right. I still think it is the case that there will be restrictions on international travel for longer than there will be restrictions on other aspects of our life, just because of the nature of what we're dealing with. But like every other aspect of our life, we need to start to chart the course back to normality, even if in this case it is a slower and more gradual course with greater mitigations required for longer. So it's a much, much more cautious approach than the one that was taken last summer, because we have worked very hard to learn the lessons of what we did and some of the regrets about aspects of what we did last summer. Helen Puttock from The Times.
Thank you very much. I wondered if I could ask about education as well. Given how long restrictions have been in place, nursery school pupils have not been able to visit the primary school they will start in August, and P7 children have not been able to visit their future grammar school. Can you give schools the green light to arrange these visits and allow smooth transitions for children? Thank you.
I'm not doing that today. If I was doing that today, I would have covered that, but we will do that as quickly as possible. I completely understand, particularly we have prioritised getting schools open and keeping schools open, and you're getting normality for children as much as possible. Just a reminder that in terms of the limits for gatherings in-house and outdoors, children under 12 don't count towards those limits. So we've prioritised the well-being of children as much as possible. But there, just as in everything else, we have to do things in a phased, staged and careful way. So I hope we'll see many more changes around this as we come to the next review point in 3 weeks' time.
Are you saying it'll be 3 weeks before you can do anything about that?
No,
it seems like an adult can go to a pub on the other side of the country, but a nursery school child can't visit the primary school that's just across the playground.
No, I'm not saying that, and please don't mischaracterise what I'm saying. We have deliberately prioritised children, so we opened schools and kept pubs closed for a lot longer. Jason's telling me he thinks what you're saying is already allowed.
I think we should check, like you said earlier, but I'm almost certain my wife, who is a high school teacher, her and her friends have done induction for P7 kids in the high school building.
This is a point of detail. I want to double check before giving information I don't have, but I really don't want to let pass this suggestion that somehow we're prioritising people going to pubs over children, because demonstrably great concern to the hospitality sector, and having been on the receiving end, understandably, because it's my job, of a lot of grief from the hospitality sector, demonstrably we've actually done the opposite over the last few months, and rightly so in my view. Richard Percival from the Daily Express.
Thank you, First Minister. I just want to have one quick question on the Queen's speech and whether you agree with Joanna Cherry that there needs to be some recognition from the Conservative government of Westminster in this speech that the Scottish Government should be treated with respect and the partnership of equals, not just in relation to COVID, but obviously on wider constitutional issues as well. Thank you.
I'm not going to stray away from COVID. I've not seen Joanna's comments, but, you know, do I agree that the Scottish Government should be treated with respect by the UK Government? I think you can probably guess my answer at that, and the very fact that question is having to be posed probably tells us about the absence of respect that we often see. So it sounds very much like I would agree entirely with Joanna Cherry's comments, albeit that I've not seen them personally. Emma Seath from Times Educational Supplement is the last question.
Hi, I just was wondering if I could just return to the way pupils are being assessed this year. You said that the results this year would be based on teacher judgment, but that's actually not true. Teachers are responsible for provisional results, but those provisional results have to be based on evidence, which is why we've got so much testing going on in schools just now. I just want to know, does the system need to change so that teachers are actually able to bring their professional judgment to bear? Because at the moment they can't.
No, I'm sorry, Emma, it is true. It is based on teacher judgment, but like any other judgment, there is evidence required to inform that judgment, and then the teacher makes the judgments on the basis of that. So it is what I said is the case and is true, but of course we continue. And remember, this is a model that was agreed to by the EIS as part of the group that developed it. We continue, of course, to listen to concerns and anxieties of young people and teachers as we go forward in this, but I think it's important that we're clear about the underpinning facts. That concludes the questions today. So my thanks to everybody for joining us. My thanks in particular to Gregor and Jason for their contributions, to Yvonne for our translation. I'm not sure I went as slow as possible at certain points in my remarks. If I didn't, my apologies to her. But thank you to Yvonne. To everybody, I hope today's update has been positive. I'm sure it hasn't gone far enough, fast enough for everybody in every part of the country, certainly not in Murray, I know, but in every sector as well. But it really remains important that we take a careful, gradual, phased, staged approach out of lockdown, because that is more likely to mean that we stay on a forward track. And as of Monday, there will be many freedoms that most of us will return to that we've missed for an awful long time. So I hope you will all enjoy those moments. We will give an update, not necessarily in this format. We'll give information on that later in the week, but we will give an update at the end of the week about the position in Murray and particularly whether or not Murray is staying in level 3 for a further period or whether there's been an improvement and it can go to level 2. But in the meantime, please continue to follow all the rules when you are out and about, continue to do all the right things. They are working and we are very much going in the right direction now. So my thanks to all of you for joining us today.